So varicose veins are basically extra pressure on the side branches of some of the larger veins. There are two types of veins in the body. There are superficial veins that we can normally see on the skin surface, and then there are the deep veins that we don't see usually. The little side branches of these main superficial veins can become enlarged from increased pressure over time. Is basically what we call spider vein, which is essentially a discoloration of tiny little hair-sized veins on the skin. Once it gets a little elevated above the skin, it can become more problematic. Superficial venous thrombophlebitis is essentially blood clot in the superficial veins. In general, there's very, very low risk for this clot to travel anywhere. It just causes a localized inflammation at that point, which can be quite painful. Superficial thrombophlebitis in general does not require blood thinners. It does usually require some sort of anti-inflammatory medication, however. If a clot forms in the deeper veins, that's called a deep venous thrombosis. And we've all heard how dangerous that can be because the clot can break off and travel to the lungs as a pulmonary embolism. In general, deep vein thrombosis requires some sort of medical treatment with a blood thinning agent, a medication that will thin the blood and keep it from clotting more. Venous ulcers basically represent the most advanced, almost final stage of chronic venous disease. Chronic venous disease encompasses all the venous problems that occur over time, and venous stasis ulcers essentially represent the last stage of that. The ultrasound technology that is available to us today allows a very precise anatomic definition of the vascular system, meaning we're able to see the veins very well. So it's a very sophisticated tool that allows us to diagnose almost any problem in the venous circulation and guide the treatment.